Hello, it's Tim Spector here from the Zoe COVID study giving you this week's update. And we're going to start with some personal information. Yesterday I went to St Thomas's Hospital and had my booster jab in my left arm with the Pfizer and in the right arm for a flu jab. I thought I'd get it over all at once and see what happened. And result was I had a sore arm as I did last time with the Pfizer jab, no worse than last time. And I had a mild headache that has in the evening last night, but has now disappeared. And I felt nothing really from the flu jab. So it's just to point out that we're adding should have added the booster and the flu jab to the app. So at least by Monday, everyone should be able to log both of those. And it's really important because really vital information about timing, side effects, what's the optimum way to space all these things out that you've been giving us. Now, we've got a lot to discuss today. We're going to be giving you some information about how protected you are long term if you've had a natural infection and you've been vaccinated. That's coming up later. We'll also be diving into why cases are still going up in this country and how I believe that the government's failure to tell people about the symptoms is one of the main drivers of that. So let's now get down and look deep into the data. And number of new cases estimated from the Zoe app is up again from last week slightly at 66,000. And most of these are still in the unvaccinated population, with about a quarter coming from people who are fully vaccinated, at least had 2 doses so far. And this gives us a UK R value of 1.1, showing that things are still slightly on the increase. And deaths over the last week have averaged about 1,108. That's about 158 per day. But if you put that over a year, that's over 50,000 individuals, which is far too high. And that figure is slightly up from last week. Long COVID is slightly up again, around 930 cases a day estimated. And hospitalizations, as we saw last week, has again come down slightly, which is slightly confusing, but it's down to about 642 cases a day, and there are about 769 people on ventilators around the country, for still putting a fair bit of pressure on those intensive care units that we want to try and avoid. Now, the number of cases we're seeing is greater than the confirmed cases, but our data are in line with the other surveys, such as the ONS, which is reassuring. So if we dig into what the cause of this increase in cases is and who's getting infected in the last week or so, we can see, as in last week and as we've been predicting, that this is really being driven by school-age kids, perhaps some students, and rates are really still increasing quite rapidly in this group. And there have been studies, independent studies, showing that 1 in 20 school kids are testing positive in some surveys. And I think this is just because kids are going to school without getting a test at home. They're going with these respiratory symptoms and infecting people before they then later test and then get sent home. And you can see also from the graph that the group 35 to 55 is also increasing, and that is quite possibly because they're the age of parents who are getting infected from their kids. Luckily, we're not seeing any big increases in the over 55s, over 60s, and because most of the cases are in the young, that's probably why hospitalizations are still down at the moment. And hasn't yet broken through into those older age groups, which I think is good news. So let's look at what's happening with COVID around the UK. And you can see from the graph that cases are going up in virtually all the regions except for a couple of them. One is Scotland and the other is Northern Ireland. And Scotland had a rough time and got a lot of the peaks before the rest of the country, but it's good to see that coming under control now. And Northern Ireland similarly, although our estimates are not as accurate there. But particularly interesting, I think, is to look at what's happening in Wales, which we saw last week but didn't comment on. Rates have really been going up very fast in Wales from a very low base. And I think that's the other point. They really didn't have many problems in the summer that the rest of the UK did, but finally are starting to see quite bad problems. And it will be interesting to see the effect of vaccine passports, which they've brought in for nightclubs and evenings events there, is going to have. If we look at the rest of Europe, we would expect this to increase vaccination rates and drive down some of these recent increases. Now, across the rest of the country, we're starting to see more regional differences. The south looking less problematic, rates going up in the Midlands and the north of England. Particularly worrying is the Midlands, that does seem to have the least capacity to deal with large amounts of emissions, so we keep a close eye on that. And I think looking at those rates plus also any change in the age groups is going to give us an indication of whether we're going to run into problems as we get into winter and flu season. So now let's have a look at symptoms as we do every week. And it's been 548 days since we've been trying to get the government to change their mind on this. Here are the current 5 top symptoms: runny nose, headache, sneezing, sore throat, and loss of smell. Fever is not there, persistent cough is not there, and this is what the symptoms that are actually out there, really looking more like an upper respiratory type of problem, driven either by the fact of most people being vaccinated or the new variant. And people ask me, why do you think the government haven't updated their symptoms list as they have in other countries? I generally don't know, but I think there are 2 possibilities that people have suggested. One is that they're worried about capacity because they think there'll be a sudden run on tests and the government will look embarrassed if there aren't enough tests to go around. This is crazy to me because we have more testing than any other country in Europe, and we're not even near our current capacity at the moment. And so I think that could easily be managed with an education campaign. The other reason I think is the general belief by the government that the population aren't clever enough to realise the actual symptoms. They don't think they understand the 3 classic symptoms anyway, and giving them more would just confuse the public and therefore not help the situation. I think they're underestimating the intelligence of the British public, or certainly a large majority of them. And I would ask Dr. Susan Hopkins, who is now the Chief Scientific Officer of the new organisation, the HSA, which has replaced Public Health England, to stop dithering and make a decision on this, because it's really getting ridiculous. We've actually estimated that they're underestimating the number of symptoms by about 40%, and 40% of people are out there spreading their germs around, going to school, and keeping these rates ridiculously high compared to other countries. And we've got confirmation of this because we record on the Zoe app, you do, how many of you are reporting classic symptoms and getting tests. So as well as the non-classic symptoms we talked about, we've seen that there are still 20% of people that have all the classic symptoms that aren't getting tested with a PCR, that doesn't get any official recognition, etc., or a lateral flow. And that's actually got much better over the last year as the tests have become more available, and I think education's got better. But it's still poor, because when you think of that 20%, that's people using the app, which are better educated because of the interaction with the device than probably the vast majority of the population. So huge underestimates of the number of cases, which again is causing problems and keeping these infections going, even with a reasonable level of vaccination. So it's still a major problem out there, and I'm going to keep banging on about it until something's done. So we know that official confirmed cases are an underestimate of what's really happening across the country, although that's probably fairly general around the world. But it's interesting in the UK that tests more than any other country in Europe. So one of the best ways to look again internationally is the number of admissions in hospitals, which are better documented, and see how we're comparing that way, which is an idea also of the number of severe infections and stress on the health service. And if we look at the latest graphs, we can see that whereas there's good news that most of the countries we're looking at are seeing a gradual decline in admissions, the UK remains the highest of all the large countries in Europe by a long way, 3 to 4-fold more admissions than any of these other countries. And we know that in the UK, our population is only 66% double vaccinated, and there are quite a few people who only had single shots, and we now know that that really offers very little protection against the Delta variant, unlike earlier variants where it was much more effective. So those people really do need to get a second shot. And let's now look at the vaccination rates across other countries as well, see how we're doing. We used to be leading the world in this, and we're very proud of that. But if we look at this now, and this is the percentage of the full population vaccinated, not just adults, as kids are being vaccinated now, we can see that Spain, Portugal, France, Denmark, Italy have overtaken us in vaccinations and also have lower rates of hospitalization, which is a mixture again of the vaccine working, but also having some sensible restrictions in place, which we've taken away. And there are other countries that are also ahead of us in boosters. So not only Israel that started this off, but also Italy, USA and France is ahead of us there. So I think our numbers and our lack of speed of increasing vaccination, the fact that it's really plateauing off in the last month, means that many other countries have actually put us on their red list. And people only find this out when they try to travel and realise that the sort of propaganda the government's been saying about how other countries are the risk and we should be quarantining here, actually the reality is much more the other way, that other countries have realised that we're the main risk because of our high levels. And we know that our own travel restrictions and traffic light system was finally relaxed this week, which helps some people coming back into this country, but about 6 months too late, as you know from my various complaints. But the number of countries that have put the UK on its red list, meaning you have to quarantine there, has actually grown. And this data isn't easy to find and certainly not being publicised by the government. But as far as I could find, just a quick check, it now includes people going to Belgium, Sweden, Germany, Finland, Estonia. If you want to fancy going to see the pyramids in Egypt, some diving in the Maldives or Sri Lanka, you can't go there, and you certainly still can't go to Australia or New Zealand. So I suspect we're going to see more countries putting the UK on the red list until we get our rates of infection down or our vaccination rates up. So now I want to talk about our new data on vaccination after natural infection and natural immunity. Your data has been invaluable in giving us this information, and we know that vaccines are extremely effective, but they do slowly wane over time, and that's why there's this need for these boosters. So we asked you to record whether you had had an infection that was confirmed by PCR before having your full vaccination, and looked at reinfection rates in those that did and compared those that didn't. And you can see from this table that we had a really reasonable response, which is what the trial showed, of around 71% in AstraZeneca and 83% protection with Pfizer between 0 and 6 months, so up to 6 months if you'd hadn't had infection. But that rate went up to 90% for Astra and 94% for Pfizer if you'd had that previous natural immunity. So in a way, you're getting 3 vaccinations, like having an extra booster. So this is extremely encouraging, and this even happened even if that infection was up to a year before you had the vaccination, and that really is really great news for many of you out there. And just to put this into some perspective, if having had COVID without being vaccinated only gave you about 65% protection against catching it again. So it's really this combination that is good. So if some of you have suffered both some side effects of the vaccine and had COVID, at least you know that your risks are really very much reduced as far as we can see at the moment. Now, obviously, this is good news about some long-lasting protection. We don't know exactly how long it's going to last. You need to keep giving us the data for that. We don't know that this applies to people over 65 because we had to group everyone together to get the numbers about reinfection. We don't know whether this applies to people with very specific comorbidities or disease. But I think in general, for those in the broad groups between 18 and 65, it is very good news. We don't know if infection after you've been vaccinated gives the same protection. In theory, it sounds like it probably will, but we really don't have any hard data on that. And the immunology is so complex, it's very hard to be sure. So this isn't a recommendation to go and get infected if you've been double vaccinated, as of course there are still the risks, not only of the COVID and the new variant, but also very real risks of long COVID for both young and old people. So to sum up, rates are going up, hospitalizations are going down. This is because it's driven by young people. But the good news is that if you've had a natural COVID infection, you're going to be double protected when you get your double vaccination, which should give a lot of people peace of mind. Do remember about your symptoms. These are the real symptoms of COVID, not the ones the government is still telling you about. Really important to log your boosters with us and also your flu jabs, so we can start to separate out which ones should be given when and how long all these effects last. This is incredibly useful information you're providing us. So do stay safe, do keep logging, and thanks again for your amazing support, and like and subscribe all the channels as usual. See you next week.